Good day everyone. In this video, I will be talking about Hydrops uteri, which is a problem during pregnancy wherein there is an excessive amount of fetal fluids within the pregnant uterus. And it is a sporadic condition that usually occurs during the last trimester of pregnancy. This is usually seen in cow and in the mare. There are two forms of Hydrops uteri, which is the Hydrops amnion or the hydramnios and the Hydrops allantois or the hydralantois. To differentiate the two, Hydrops amnion is a fetal dropsy and an enlargement of the amniotic sac, while the Hydrops allantois is an abnormal enlargement of the allantoic sac. Let's now go to the etiology. So first is the hydramnios, which has an associated abnormality of the fetus, especially cleft palate as you can see on the picture. And then it has slow progressive enlargement with eventual pear-shaped appearance. The hydralantois usually accompanied by abnormal placentation. There is reduced number of placentomes and adventitious placentation. There is possible interference with sodium metabolism at cell level suggested. The Hydrops allantois often causes rapid, from days to weeks, abdominal distension that results in a rounded abdominal appearance from the rear view. This condition is more likely associated with twinning or multiple fetuses. The pregnancies resulting from current in vitro reproductive methods, such as those that produce cloned or transgenic fetuses, are more likely to have irregular placentation and as a result are at a higher risk of developing Hydrops allantois. These Hydrops allantois can be caused by nutritional deficiencies, and those calves that are delivered can survive, but they cannot be used for breeding. The clinical signs: in the hydramnios, there is more amniotic fluid during calving, or there is syrupy consistency and excessive enlargement of the abdomen, wherein it might be suspected with having twins. And then, due to increased weight, the cow may show difficulty getting up. While on the hydralantois, there is rapid onset and it is life-threatening. There is also enlarged abdomen and tense. And in these hydralantois, there are up to 200 liters or 440 pounds of extra fluid will accumulate. There is also labored breathing. Appetite is depressed. So this picture shows the distended abdomen of the cow. As we can see in the picture, we could really suspect that there is two calf that is present inside the cow's abdomen. That's why it is distended, but actually that is called Hydrops allantois. There is also a rectal or vaginal prolapse. There may be hip dislocation, rupture of prepubic tendon, and recumbency. To diagnose Hydrops uteri, we could do rectal examination and ultrasonographic scan of the uterus. So during rectal examination in hydramnios, we could see the fetus and placentomes are palpable, but the uterine horns are more difficult to palpate. And then, while on the hydralantois, the distended uterine horns appear to fill the abdomen, but due to the increased fluid content, palpation of the fetus and placentomes may be impossible. And on the ultrasonographic scan of the uterus, in hydramnios, there is large amounts of amniotic fluid that are present, and at birth, there is an abundance of amniotic fluid. Then the placenta may be preserved and the calf may be deformed, as happens with other forms of uterine distension and inertia. Differential diagnosis. In hydramnios, it could be other causes of abdominal enlargement. In hydrolantois, it could be normal twin pregnancy, hydrops amnion, ruminal tympani, abomasal disorders, peritonitis, and ascites. So, on the treatment, there are several recovery choices available when treatment is chosen. If the uterus has not already been stretched beyond physiological limits, we could induce parturition. We could also choose surgery, but the uterine fluid must be released through a Foley catheter over 30 minutes to 2 hours, while intravenous fluids are given quickly, since this would avoid the rapid onset of shock that can occur as venous fluid shifts into the splanchnic pool as a result of abdominal decompression. The treatment specifically on the hydramnios is by assisting during calving if the cow is bright and active. We could also terminate the cow's pregnancy by injection of prostaglandin factor 2 alpha. While on the hydrolantois, there are things to consider, which is the calving date in the future, the dam's health, especially her ability to rise and eat, the calf's viability if known, and the cow and calf's relative worth, if the nursing care is readily available. So the following are methods on how to treat hydrolantois. So number 1 is conservative or wait for the development, which could be the best option if the cow is in good health and her calving date is approaching. So number 2, diuresis, which is not really very effective. Number 3, the uterine drainage, wherein it provides immediate relief, but the uterus quickly refills, posing an infection risk. So next is the induction of birth, which there is risking of losing a premature calf, and this could be done by administering 20 milligrams of dexamethasone intramuscularly, followed by intravenous drip of oxytocin, given over a period of 30 minutes, and it's possible that manual assistance with delivery will be needed. And lastly, the elective cesarean section with partial drainage of the uterus before surgery. So take note that cattle who are unable to stand or have serious musculoskeletal injuries must be euthanized. And so now let's move on to the hydrolantois in mare. So in mare, the hydrolantois is rare. The onset is on the approximately 7 months of gestation. Signs that could be seen is massive abdominal distension and colic. So to diagnose hydrolantois in mare, we can do rectal examination in which there is gross uterine enlargement and tension. The fetus is seldom palpable. And also, transabdominal ultrasonographic scan can also be done, in which we can see the presence of excess amount of uterine fluids. On the treatment, the same with the previous Hydrops Uteri, which is the administration of prostaglandin factor 2 alpha. In later cases, some veterinarians would dilate the cervix and then puncture the chorioallantois, and so the foal will be delivered. So next is the Hydrops Uteri in other species. So occasionally in sheep and dog, hydramnios usually occur. While rarely life-threatening, it can require a cesarean section or treatment of associated uterine inertia at term.